Good afternoon. This is me, Dr. Layla Adel, a specialist psychiatrist, and to who doesn't know me, I have a channel on the YouTube called 5 Minutes Psychiatry, which we are trying to increase the awareness about psychiatric illness, how to diagnose, what are the symptoms, how to manage. So please subscribe to my channel, open the notification and share the video. As we share, we grow. Today we are going to talk about panic attack and disorder. Panic attack is simply it's a period of intense fear and discomfort associated with physical symptoms. According to the DSM-5, the Diagnostic Manual and Statistical of Psychiatry, which is the manual of how to diagnose psychiatric illness, says that if anyone has 4 or more of these symptoms, so he must suspect that he has a panic attack. As we said, it usually come in the form of physical symptoms, so it will be palpitation or pounding heart or racing heartbeats, sweating, shortness of breath, choking, GIT upset symptoms, from nausea, anorexia, hot flushes or sometimes chills, feel of light headache or dizziness, feel that he's going to die, sense of impending death, feel of detached from oneself, depersonalization and derealization, and all these symptoms, if we have 4 or more of these symptoms, we can suspect that we have a panic attack. The duration of panic attack stays from few minutes up to 1 hour. Panic attack can happen in a context of many other disorders like the major depressive disorder, post-traumatic stress disorder, social phobia, panic disorder, and all of us might have experienced at least 1 or 2 panic attacks in all his life, while going to have an exam, while having an exam, while car accident, or any trauma can have diagnosis of a medical illness. All of this can have some symptoms of the panic attack. But to diagnose a panic disorder should be first recurrent panic attacks. After 1 month or during 1 month of the attack, there is preoccupation that the attack may happen again, or the fear from the consequence of the attack, or avoidance of going to the places where the panic attack used to happen. So there is significant change in behavior by avoidance. Panic attack can happen anywhere, can happen at home, can happen at work, during driving. There may be avoidance, like I say, change in behavior, like people try to avoid the place where they think that panic attack, they think it may trigger the panic attack. Okay, so now we knew how to diagnose panic attack and panic disorder. Why? Why do I have a panic attack? Panic attack, simply there are a lot of reasons for it. The first one is genetic. There is a problem of the gene expressing serotonin. Second one is low serotonin, which is the main reason. Other hormones disturbance like stress hormone release, cortisol, adrenaline, and dysregulation of thyroid hormone. How to treat panic attack or how to treat panic disorder? Treatment is very easy. Although the patient may have all the time feeling that he's having heart attack or he's dying, sense of impending death, and he went to a lot of physicians, a lot of GP, a lot of family medicine, and a lot of investigation were done, EEG, ECG, echo, MRI, they go to the ortho doctor, they go to the GP, like I said, the primary physician, they go a lot of doctors except the psychiatrist, and still they didn't find anything. They tell them you are normal, you don't have any problem. So it's a diagnosis simply we can do when we just make a visit to psychiatry. When we diagnose panic disorder, we have 2 lines of treatment. The first one is the pharmacotherapy, which is mandatory through something called SSRI, serotonin selective reuptake inhibitors, which are medications. We have a lot of variation of this medication because there is individual variation. We should tailor the treatment according to the need of the patient. You cannot fight panic alone. You cannot fight fear alone. It should be a medicine. The medicine will help you so as not to feel that you are stuck in your home and you are hostage in your own home. Second thing is psychotherapy, is the talk therapy, cognitive behavioral therapy. You have here cognitive distortions that lead to a certain behavior. So we have to correct this cognitive distortion. You have to learn from your experience that panic attack is not dangerous anymore. It's not, I'm not gonna die, I'm not gonna have a heart attack. Panic attack just form of anxiety, symptoms due to anxiety. So all you have to do is just talk to yourself, or any relative should talk to you, calm you down. This is just an anxiety disorder. You'll be fine. You're not going to die. You're not going to have a heart attack. Just try to calm yourself down. Also, a line of treatment which will be very effective with the medication is deep muscle relaxation, like stress relaxation techniques like yoga, meditation, deep muscle relaxation, deep breathing. Also, aerobic exercise will be very helpful, and having enough sleep. Panic disorder is an anxiety disorder, should be treated by medication. So please stop going to all other doctors, all other branches except psychiatry. You need a psychiatric consultation. This was a brief talk about panic disorder. As I told you before, stay tuned to my channel, subscribe, open the notification. We share, we grow. Share the video. Bye.